We are on track to see more opioid overdose deaths this year in Erie County than ever before. That is the headline from today's quarterly meeting of the Opiate Epidemic Task Force. And there is now a particular focus on cocaine, with that drug showing up in 81% of the confirmed or suspected overdose deaths that had toxicology results. That is twice the percentage from just 2021. As of July 28th of this year, 245 people in Erie County have died from suspected opioid overdoses. At the current rate, we will surpass previous death tolls. Joining us live right now is Cheryll Moore. She is the director of the Erie County Opiate Epidemic Task Force. Cheryll, I appreciate you coming on, and I think most of our viewers would associate fentanyl-related overdoses with heroin because we've talked about that so much. But you really are putting the message out right now about cocaine and how it is such a big factor now in what you're seeing in these tragic deaths.
Absolutely. We're seeing a completely different cohort of folks today being affected. People unintentionally, completely. Cocaine is a stimulant, whether it's in the form of cocaine or crack. You know, both of those are the same component chemically. They're being cut with fentanyl today. People do not intend to have an opioid in there that is a stimulant. So when they are hit with it, they're blindsided, they go down, and many, many people are dying that way. This is very social generally when we talk about cocaine. It tends to be someone older also. We're looking at a correlation with age, and we are seeing a drastic increase in age in the people that we're losing.
Yeah, Cheryll, in terms of the numbers that you put out today, the percentage of deaths in people age 60 and older increased from less than 10% in 2018, now almost 20%. I mean, you know, actually 8% to 19, more than doubling in a pretty short period of time. What does that tell you about how this epidemic is changing?
Completely changing. As I said again, different people. There is a perception in the community that cocaine is okay because it has been known as a social drug for many, many, many years. Historically, people would perhaps not use drugs all the time, but in a social situation, maybe they went out with friends, they had a party, social situation, they went to a concert, and at that time they would do a line or do a bump, and things were all good. Well, that was, 30 or 40 years ago. I would never condone in any way, shape, or form today. Everything we are seeing out there, and as you noted, 81% of folks that we have confirmed the toxicologies, there is cocaine and fentanyl in their toxicology that caused their death. This person really is not seeking an opioid. They are seeking something completely different. And in many times, this is not the person we talk to every day. It's sporadic and they're blindsided. This is, people are really being poisoned with this. Today, I will tell you, no cocaine, no product is safe. People should not. I really would appreciate it if they didn't use it. If you're going to, make sure that you test it. We provide fentanyl test strips for free from the county. We are more than happy to get them out to people. The Matters program does also. We ask that people test the product, know what they're getting into, go slow, take a taste, and make sure someone is there with Narcan. The best message is really nothing is safe. It's all adulterated, and that's what we're seeing here.
Sure, I want to read a quote that you said today. We are being as direct as we can when we say this. If you are thinking of taking a line of cocaine or smoking a crack rock, you are at a deadly risk of a fentanyl poisoning, and it could be the last thing you do. You also stressed today the importance of having Narcan. And I saw some comments on social media today, people not sure, does Narcan work? We think about Narcan with heroin, other opioid overdoses, the effectiveness here of Narcan with these cocaine pills or cocaine use.
These overdoses, the problem is when you stop breathing, it's not the cocaine component of it, it is the fentanyl component. Fentanyl is a very, very strong opioid. That's what it is. So yes, absolutely, Narcan works to get you breathing again.
And to be clear, you can get Narcan. It's readily available out there, right?
Absolutely. You can get it from the county. There's the Text for Narcan program. There is the Matters program in Western New York. It has also been approved for over-the-counter sales, so they are currently trying to figure out, where it's going to be. This is what people have to understand. This is a very, very safe drug. No one's ever going to be harmed by it. When I say over-the-counter sales, like you can buy Band-Aid, you can buy Narcan, where you buy aspirin. Currently, right now, they're just restructuring and getting it out for sales. So probably we're hoping September, October. At the same time, we will continue to provide this life-saving tools to people. People can also go to their drugstore currently now. They can charge it back to their prescription plan, whatever method works for someone.
Yeah.
We have it sitting in the Rath building in the lobby. Anybody can walk in any day and pick up what they need. They can talk to a peer. They can get support if that's what they need. There's many, many mechanisms. We have great treatment agencies in the community also. We have the addiction hotline that can also refer you.
Yeah.
So all these different ways of obtaining this life-saving tool. If something is going on in someone's home and you know that somebody maybe is experimenting or struggling, you really need to have Narcan. But
Yeah.
once again, everyone should have it. It is simply first aid. It should be in everyone's first aid kit because, as we've said here, this is a different person. These overdoses are completely unanticipated, and you just don't know when you're going to need it. You can't be running to the store at the time of an overdose. That's way, way, way too late.
Cheryll Moore is the director of the Erie County Opiate Epidemic Task Force. Cheryll, thanks so much for your time today. I really appreciate it.